Let's talk about promoting health literacy. The words that we use with patients really matter. I'm going to walk you through a study that really illustrates this point. So a group of researchers gave patients a hypothetical diagnosis. They asked them to rate from 1 to 10 how problematic they thought that this condition was. And they picked some terms that one might use to describe a fracture. There's a crack in your bone. You have a broken bone. You have a fracture. You have a hairline fracture, or you have a green stick fracture. These are all terms to use to describe the same type of medical phenomenon, but the patients really had different views on each one of those terms. Their ratings varied considerably. What's most interesting about this is the difference between using a layman's term like you broke a bone to a more technical term, a descriptive term for a fracture, a green stick fracture. So for the most commonly reported severity rating for the broken bone was a 7 out of 10. But the most common rating for a green stick fracture was a 4 out of 10. So there's really two important things to take away from this. One is that the more specific medical terminology seemed to be less problematic for the patient. At least in this example, the patient was a bit more at ease. The second thing is that there's been other studies that really show that these days patients typically turn to YouTube and Wikipedia for their healthcare information. So if we want our patients to get the most accurate information from their own searches, we need to really arm them with the right search terms. And that is an example of how to promote health literacy in the modern era.